Hi, it's Dr. Darren Schmidt at the Nutritional Healing Center of Ann Arbor, and I have two stories for you. They're both true. The first one is about how somebody changed their diet to reverse cancer, and of another person who changed his diet to accentuate his cancer and effectively commit suicide. So with this first one, this is called the protocol that killed cancer, and I've talked about this before, but this video is about mostly this, and it's a quick and easy reference on how this has worked. It's worked. This is about what one person did successfully, and then I've had 3 other people reverse their cancer. Now, I'm not an oncologist, I'm a chiropractor. So whatever you do with your oncologist, that's your choice. They got all kinds of radiation surgery and chemotherapy. They're not going to really help you with your diet. Most oncologists believe that sugar is not a problem when it comes to cancer. But it is a problem. It is the problem. And toxins too, but sugar is the problem. So this is what one person did. She achieved ketosis most of the day, and she fasted 20 hours per day, and during that time she had 6 tablespoons of oil, which accentuates ketosis or facilitates ketosis. She had a 4-hour eating window, and during that time she had juiced vegetables. She also had some animal fat and protein because her body needed that, and it gave her enough energy and calories to get her through the 20-hour fasting. Now, there's 6 tablespoons of oil. That's a lot of energy and calories there too. But during her 4 hours of eating time, it was not a low-calorie diet. She had enough food to keep her happy and going. Okay, and then point number 4 here is she had liver, and I gave her liver supplements. And if you've seen my other videos about lactic acidosis, that's the mechanism of chronic disease, including cancer. So she addressed all 3 points of lactic acidosis. You can see some other video on that. So she woke up in the morning, let's just say it was 8 o'clock in the morning, and she didn't eat any food except for coconut oil until 2 p.m. Her eating window was from 2 to 6. And then she went to bed and woke up in the morning and didn't eat again until 2 p.m. to 6 p.m. And it took 3 months. She had lung cancer that metastasized to her brain during the previous 2.5 years. She was constantly growing tumors. At the 6-week mark, she had an MRI at University of Michigan Neuro-Oncology, and her tumors stopped growing, and there were no new tumors, and the doctors were baffled. 6 weeks after that, so at the end of 3 months total, all of her tumors were gone from her lungs and her brain, and even the arteries that were feeding the tumors were gone. I gave her the liver at the 6-week mark because even though her tumor stopped growing, she was still crying every day. That's what she told me, and she couldn't think straight. As a matter of fact, when I talked to her, she couldn't look me in the eyes. She was very introverted, which is a sign of deep lactic acidosis. And at the 6-week mark, I gave her a liver supplement, and at the end of 6 weeks after that, she was looking at me in the eyes, and she even made a joke once. So mentally she got better because her body was cleaned of the burden of the toxic waste of glycolysis, and including lactate and the acid that comes off of glycolysis. So lactic acidosis was cleaned up. So there you go. There's that protocol. Now, I had a patient years ago, maybe 10 years ago, and when he came to me, he had colon cancer. He had radiation already, and he had surgery already too, and I don't think he had started chemotherapy yet, but the doctors told him, no lettuce, it's too hard on the colon. Well, when he came to see me, I told him, eat as much lettuce as you possibly can, because even iceberg lettuce and other lettuces have been shown to reverse colon cancer. So he was eating 2 heads of lettuce a day, and he wasn't telling his MDs, and he was doing really, really well. And he was going to the clinic, the cancer clinic, and he was helping the other patients because they were in their on the really soft chairs and they could barely move, and he was getting water for them because they were thirsty. And his daughter said, "Dad, you gotta sit down and wait." And he goes, "But these people need help." Well, they're going through the same treatment that he was going through. At this point, he had started chemotherapy, and his energy was so good. And then the colon cancer was gone at a follow-up visit at the hospital. But he did so well that the doctors at the hospital, the oncologists, were having special meetings to try to determine why he was doing so well compared to the other patients with the same diagnosis and the same treatments. So I offered to the patient, I told him, please tell them that I would be happy to come to the hospital and teach them why he's doing so well compared to the other patients. Well, they turned that down. They just decided it was the chemotherapy, something's about the chemotherapy. Okay, so a few months go by, and I haven't seen him. I get an email from his daughter, and she says, the cancer is back. So my reply back to her was not, is he eating sugar? My reply back was, get him off the sugar. Because if the cancer comes back, it's only because of the consumption of sugar. That was the reason. And I didn't have to ask. I just knew it. So he went through another round of chemo, and he started eating lettuce again. He got off the sugar, and again the cancer was gone on a follow-up visit at the hospital. And again, the doctors were baffled. How is he doing so well? And then the daughter graduated from school. She was working on her master's. And a week after she graduated, he got a tin of peanut brittle, a big tin of peanut brittle, and he ate the whole thing, and he was dead within a week. And he committed suicide that way. He had promised his wife, who had died 10 years earlier, that he would see his daughter through college. Well, right after college was done, his job on earth was done. And he knew exactly what he was doing. He was a smart guy. He had a large presence. He was a very captivating person. And so he committed suicide by peanut brittle, and he fed his cancer, and it only took a week, and he was dead. So that's how you can facilitate your cancer and possibly commit suicides, by eating sugar. Okay, now the opposite, I already told you that was the beginning of the video. And these two stories are complete opposites of each other. And I just want to share this with you because now you have this full range of understanding. All right, if you like this, give me a thumbs up. Thanks.